Hello, everyone. Welcome to Family Source Consultants webinar. My name is Chris Gao. I'm the Client Development Advisor at Family Source Consultants, and I will be your host today. Today we will be talking about how to choose the right fertility clinic for surrogacy, specifically talking about what to look for when parents are starting to consider building their families through surrogacy. And we have a very special guest joining us, Dr. Sasha Hakman from HRC Fertility. Doctor,
Yes.
can you welcome to our
Thank you. Thank
webinar.
you for having me participate in this.
It's such a pleasure to have you, and we can't wait to hear your knowledge and wisdom. So can you please start with introducing yourself and HRC to us?
Sure, yes. So my name is Sasha Hakman. I'm a double board certified OBGYN and reproductive specialist. I'm at HRC Fertility, which is a Southern California based company. We have multiple locations. I'm based out of our Beverly Hills location. So, right kind of in the heart of LA, though we do have multiple locations in LA.
Mhm.
And I've been here after sort of moving around, and most of my training was in Michigan and in Georgia.
Oh,
And I
wow.
really I really thought that I would settle in Michigan to practice there. And while that's where my journey for practicing fertility medicine began, it certainly is ending here in LA as we absolutely love it here.
Right? Yeah. Who can complain about the beautiful weather all year round?
Absolutely. Yeah. And you really get to feel like you have easy access to a lot of nature, which is a great perk of living here.
I know, right? Yeah, I myself live in Boston, so I'm so jealous that you don't have the harsh winter.
Yes, it is a luxury, that's for sure. And I'm
Mhm.
Canadian, so I know firsthand.
Oh, well. Thank you again for joining us today. We understand that surrogacy is a long and complicated process, and it's overwhelming for a lot of, people who are just starting to look into it because there's so much information on the internet, and it's hard for intended parents to really figure out what information applies to them, what does not. So today we really want to help the intended parents navigate how to find the right fertility clinic for them because there are so many fertility clinics out there. What are the things they should look for to find the best option for them? So first, what do you think are the key factors for intended parents to consider when they're choosing fertility clinic, especially for surrogacy?
Absolutely. Yeah, there's a number of things that really should be considered. So, the first thing you want to think about, of course, is the embryology lab, because that's really where the success comes from. You could have an
Yes.
amazing doctor, an amazing team, but if you do not have a good and successful embryology lab, then
Mhm.
you're really not maximizing and optimizing your chances of success, especially when there's so much realistically financially on the line.
Right, right. But like I think I agree with that wholeheartedly. And embryology lab, I feel like is, they're kind of like the heroes behind the scenes. A lot of parents
Yes.
don't really get to interact with them.
Right.
So can you share a little more about how can a parent kind of like get to know the embryology lab, or how do they learn anything about the embryology lab through the nursing team, through the doctors, and like how do they just know that information?
So, luckily in the US, something that's very unique about doing IVF in the States is that we have an organization called SART, and
Mhm,
it stands for the Society of Assisted Reproductive Technology. So if you go to
mhm,
sart.org, a lot of the major clinics and practices they actually pay a membership fee in order
mhm.
to publish their data. And SART is highly regulated. So there's a lot of rules in terms of how you are sharing your pregnancy results. And it's divided based on age category for the female age, because we know that the number one predictor of
Mhm.
reproductive success is female age. So the source of the egg, essentially.
Mhm. Yep.
Donor eggs do have their own category because they're generally speaking very young females with no history of infertility. So they do get their
Mhm.
own category, but aside
Mhm.
from that, it is divided by female age. It's also divided by singleton pregnancy versus multiple pregnancy, the success rate from the first embryo transfer. And so you
Mhm.
see all of these categories that are laid out that can sort of help you discern what a lab success rate looks like based on your demographics as the patient. And
Mhm.
SART has a lot of rules in terms of how you input that information so that people
Mhm.
aren't sort of falsifying their data to make them look better. And so people that don't necessarily follow all of SART's rules sometimes can sort of get pinged by them, and they'll actually send someone over to the lab to oversee
Mhm.
exactly how they're doing things. And it could sometimes be unintentional from the clinic standpoint. So it's not necessarily that they're trying to make themselves look better. Sometimes they'll even sort of input their data in a way that makes them look worse, and SART will come in and say, hey, here's what you have to do to sort of help yourself out. So
I
there are a
see.
lot of nuances to the data you read on SART. So although it is an amazing tool to have, there
Mhm.
are still some nuances that can make a clinic look better or worse. And some of those
Mhm.
things are how we control the numerator versus the denominator. So if I have a
Mhm.
patient that's coming to me to bank embryos for the future and they don't want to do an embryo transfer, but I mark that cycle as an IVF cycle, it makes me look
Mm.
bad because
Right.
I just made the embryos, I didn't do an embryo transfer.
Transfer. That's right.
And so it looks like a failed transfer cycle and will bring down my pregnancy rates. So I have to report to SART that this is an embryo banking cycle for fertility preservation, as an example of things that
Mhm.
can affect your pregnancy rates.
Right, absolutely. Wow, thank you so much for sharing those details. And, success rates is definitely one of the big topics that a lot of parents ask about, and definitely one of the things I, wanted to talk about today. And we went right into it. And thanks again.
Yeah.
That I think that's very helpful. So, just to recap, for parents who are looking into surrogacy when they go to sart.org, they should try to find a success rate specifically related to egg donation if they also need an egg donor, as well as surrogacy cases for the clinics they're interested in. Is that correct?
Yeah, I mean, for surrogates, it's not necessarily always documented that way, and so
Mhm.
it does help to look at donor eggs. But usually, if you just look at your age category, so if you're using your own eggs, for
Right.
instance, that's what you really want to
Mhm.
look at,
Okay.
and just sort of see the overall data. Now, keep
Mhm.
in mind that the data is a few years behind, so it's and
Mhm.
looking at preliminary data doesn't necessarily reflect what the final data is going to be for a given year, because we're updating it on an annual basis, but there's a lot that
Mhm.
goes on behind the scenes before it actually gets published, so it's always
Mhm.
years behind. And so
Yeah.
what I will say about interpreting the SART data is that you want to sort of make sure that the clinic you're going to is somewhere falling somewhere in the average. So let's
Mhm.
just say if I am 37 years old and I'm looking
Mhm.
at the 37, 38-year-old category, I
Mhm.
want to see that the clinic that I'm going to go to falls somewhere close to other clinics in that particular geographical area, because geography
Yes.
does matter, because we're talking about different
Absolutely.
patient populations. And
Mhm.
so there are variations depending on where you go. So if I look at a clinic in LA, and HRC, for instance, has similar pregnancy rates to other big clinics in LA, then
Mhm.
that tends to probably be somewhere roughly around the same thing. So
Mhm.
if another clinic has 1 or 2% or even 5% higher, it doesn't necessarily
Mhm,
translate into a better lab or into better success rates. But that being
mhm,
said, one important piece of it, aside from looking at SART, is when you do that initial consultation, really having a serious discussion with the physician that you're consulting with about what their own statistics look like. So
mhm.
for myself personally, I always go to our embryologists and even our lab director to ask, what does our lab success rate look like for even down to the grade? Like, I want a euploid, highly graded embryo for this age range. What is our
Wow.
implantation and clinical pregnancy rate look like? So that I can
Yeah.
now tell my patients, if this is the grade of your embryo, this is the
Uh-huh.
success rate I expect. And if that's the grade, this is the success that I expect.
Yeah.
So I can really tailor the conversation of our success rates for our lab based on
Mhm,
what
mhm.
I expect to get from them. And also
Right.
from I can sort of tailor that conversation based on the embryos that we end up getting prior to transfer.
Yeah, that is so helpful. I can imagine, when parents hear that information, that would be such, a relief or just some sort of like comfort for them to know or to, I
Yeah.
guess, to know what to expect because obviously the quality of the embryo plays a large role in terms of
Yes.
success.
Absolutely. It does really play a large role.
Yeah. Okay, so what about international intended parents? We know, like, there's a lot of parents from other countries that come to the United States for surrogacy because of our legal regulations and,
Yes.
medical, the advanced level of medical medicine. So, what about what are the factors that international intended parents should consider in addition to, success in the embryology lab?
So, I would say just knowing that there's some form of infrastructure within the practice of dealing with international patients. So, if you are a practice, I know, for instance, with HRC, we work so much with international patients, and even like myself, I've had several patients come from all over the world. And
Yeah.
so, knowing exactly how to ensure that they're able to receive um depending on the exact scenario, let's say they're doing what we call an autologous cycle. So they want
Mhm,
a gestational carrier, but they want to use their own genetic material, their own gametes, whether it be
mhm,
eggs or sperm. Then when it comes to the female partner's eggs, we have to be able to deliver those medications, have specific protocols in place because you have to consider the fact that people coming from other countries, they are blocking potentially time off work. They are
mhm.
making travel plans, which is
Yep.
costly.
Mhm,
Plan to stay in the country and in the particular city where they're getting treatment for that duration of time. And so there's
mhm,
very little wiggle room for having somebody come in, for instance, for a baseline ultrasound to start and say, hey,
mhm.
you have a cyst, we can't start. There's no
Right.
luxury of just canceling and then bringing them back a few days later to troubleshoot. So there's
Yeah.
got to be some protocols in place that really help to be as efficient as possible while also
Mhm,
optimizing their care to maximize the success rates from their
mhm.
cycles.
Yeah, I think you nailed it. Obviously, it's very important for international teen parents to, I would say, prioritize a clinic that has worked with a lot of international patients
Yeah.
because, you just have this protocol in place and you know how to best assist international patients who,
Yeah,
like you said, time-wise and cost-wise are experiencing a whole lot of different challenges than domestic patients.
absolutely. Yeah.
And so, in terms of the clinic's experience in surrogacy, d- what role do you think the clinic's experience with surrogacy specifically play in the overall success? Because today we're talking about patients who are intended parents who are planning to build their families via surrogacy. And while IVF is a very common treatment at this point, surrogacy is kind of another level above. So, what do you think the clinic's experience in that place?
I think it plays a huge role because,
Mhm,
for instance, I've practiced in other places, and if that's not something that you commonly deal with, like I
Mhm.
previously mentioned, the lack of infrastructure makes it more prone to error. And so there
Mm.
could be more things being missed. There could also be significant delay in time to baby because
Right.
while these clinics are trying to figure out exactly how to make things happen, another
Mhm.
practice that is well versed in surrogacy and especially for international patients,
Mhm.
there's already the team in place, the people in place who know exactly what to do. You don't even have to tell them or train them. And it just sort of facilitates getting things done for the patients more
Mhm.
seamlessly and smoothly.
I see. And speaking of medical treatments and especially IVF and surrogacy, we have to talk about, the screening and the testing. There
Yes.
is a whole a comprehensive, very, very strict requirements. There are very strict requirements on how the
Yeah.
surrogates and, parents are screened. Can we talk about that? Like, what are the typical screenings or tests a surrogate has to go through?
So the surrogate typically has to demonstrate sort of proven fertility and a healthy pregnancy in the past. So I apologize, my computer in the background is sort of going off. I'm just gonna
Okay.
mute it. It's just been going on for
We
so
can't
long.
actually hear it.
You can't?
No.
Oh, that's amazing. Okay, something out on my end. Okay, so in terms of the screening that a gestational carrier has to undergo, we always want to check for we always start with a thorough history, right? Their medical history, any psychological conditions that could negatively impact the pregnancy itself, what the obstetric history is. And then, of course, we also want to kind of get to know the purpose and the reasoning as to why they're choosing to be a surrogate, because it's not a
Mhm.
small task, right? You want to
No.
you want to ideally know that people are in it for the right reason to help other families grow, and while, yes, in places like the US, there is commercial surrogacy,
Mhm.
which really helps sort of attract gestational carriers in the first place. And the,
Mhm.
the commercial aspect does improve access to care for families who really need it. We want to know that
Mhm.
the motivation isn't only financial, and that's just a
Mhm.
small piece of it for them. Additionally, aside from the history, the medical history, surgical history, psychiatric history, we also want to know that the prior pregnancy was relatively uncomplicated, as well as the delivery. We don't want the carrier herself to put herself at risk in the pregnancy, and we
Mhm.
also don't want to put the intended parent's baby at risk as
Mhm.
well. So we have to
Absolutely.
think of both sides, really.
Mhm.
Um,
Mhm.
so in addition to medical screening, there's a lot of lab evaluations that are also taking place, like infectious disease testing for both
Mhm.
parties, because we want to
Mhm.
ensure that there is no theoretical risk of transmitting an infectious disease to the surrogate, and we
Mhm.
also don't want to have the surrogate possibly be positive for something and negatively affect the IP's baby. So,
Yes.
and outside of the health aspect of things and making sure that uterus looks good, that overall pelvic anatomy is pretty well intact, we typically will have, and this is where the agencies are incredibly helpful at really coordinating and ensuring that there is a good contractual agreement between the GC and the intended parents, because there's a
Mhm.
lot of not only medical considerations, but ethical considerations as well. We're dealing with somebody else's baby and a different party's body. So there
Yeah.
we have to respect bodily autonomy of the
Mhm.
surrogate, as well as the values and the importance that's being placed for the IP's baby.
Exactly. And I just wanted to add, I think this is, one of the areas where the agency and the clinic really work very, very closely to, to screen surrogate candidates to make sure every surrogate that is matched with an intended parent is really the perfect candidate to move forward because, before an agency even shares the surrogate profile with the parents, or at least at Family Source Consultants, we do such comprehensive, screening on the surrogate. We'll complete her background check. Not only the surrogate, but also anyone that's over the age of 18 in her household will complete the background check and psychological evaluation, and also making sure she lives in a stable
Yes,
environment. She can't just be like, hopping from apartment to apartment or crashing at a friend's place, because it's very, very important for her to have that stable environment, to have the
absolutely.
support from her, family and friends, because we don't want her to experience any unexpected stress during the pregnancy, right? And there's a lot more we look into the surrogate's insurance status, and and obviously we'll collect the surrogate's medical records, and all these things are done before parent even sees a potential surrogate's profile. And again, like you mentioned, once the parent expressed interest in working with the surrogate, the clinic will complete even more strict and medical screening on the surrogate, and including infectious disease and a lot more. So this truly is a very thorough process, and sometimes parents may not see what exactly is happening behind the scenes. But please note that every professional involved in your journey has the same goal, which is to help you succeed. And we are all here to help you succeed, and we'll do our very, very
Yeah,
best to make sure you become an actual parent, right?
absolutely. Yeah. And
Yeah,
I love that you touched on the family support and the living environment. That is a big part of it. And if gestational carriers they have a partner or they're married, then that partner is heavily involved in the process because
absolutely.
I mean there's a really big component to the everyday life while you're pregnant, making sure that you're in a safe space. It's important not only for the person who's carrying the pregnancy, but also for that baby as well.
Absolutely. What about genetic testing? I know that is
Yes.
not, part of the surrogate screening, but it is also something parents ask about a lot. And what kind of genetic screening options are available out there, and how do they help with the success?
Great question. So there's two elements to genetic testing. The first we think about is the sort of chromosomal integrity of the embryo that's going to be transferred. So whenever anyone does an IVF cycle, there's the option to do something called PGTA, and that
Mm-hmm.
stands for pre-implantation genetic testing. The A stands for aneuploidy, which means chromosomal abnormality. So when you go
Mm-hmm.
to create embryos, however which way you do it, whether it's with, let's just say, with a heterosexual couple, we're using the female partner's eggs and the male partner's sperm. They come together, we create embryos in the lab, and then once the embryos are created, and this is typically day 5 to 7 after fertilization of the egg, we biopsy some of the outer cells of the embryo. And these cells are biopsied from an area called the trophectoderm. So the outer portion of the embryo will eventually become the placenta. And we're getting about on average 5 to 8 cells. So just a tiny little portion that will
Mm-hmm.
hopefully reflect the chromosomes of that embryo. So it tells us, is there the full copy of chromosomes, or is there a chromosomal abnormality? And that helps us prioritize which embryo then gets transferred to the gestational carrier.
Mm-hmm.
And
Mm-hmm.
we don't want to be in the situation of having these abnormalities and transferring abnormal embryos, it leading to unsuccessful cycles. Because it's just kind of hard on everyone emotionally, financially, physically. Um, so that's the first piece of it. So testing the embryos to ensure that we are prioritizing the embryos that are chromosomally normal, and that helps
Mm-hmm.
to maximize success there. But then the other piece of it is depending on the source of egg and the source of sperm, you
Mm-hmm.
want to do something called genetic carrier screening. And this is
Mm-hmm.
testing the egg source and the sperm source, wherever it's coming from, to ensure
Mm-hmm.
that they do not overlap in a genetic mutation for a disease that generally is inherited. So
Mm-hmm.
there's a few hundred, probably more, but currently we're testing for up to 600 diseases to see
Mhm.
if the sperm source and egg source are carriers for the same mutation. And if they
Mhm.
are, there's a 25% chance that the child is born with a medical condition that can be anywhere from very severe and negatively impact quality of life, or might actually be lethal to that child at some point in their life, whether it's the first few days of life or the first few
Mhm.
years of life. Either way,
Mhm.
it's a devastating outcome. And in those
Yeah.
scenarios, when we know that that is the case, we could test the embryos for that particular genetic disease and
Mhm.
exclude the ones that are affected by that disease.
Wow. Yeah, thank you. Thank you so much for sharing that. And I think it's very important for parents to hear what, genetic testing options are there so they can make an educated decision what is right for them and, to have the best chance of success.
Yeah,
And
absolutely.
we all know surrogacy unfortunately is also a very expensive
Yeah.
procedure or process. So when it comes to the medical services, um, are there any of the services covered by insurance?
So that varies tremendously. It
Mm-hmm.
depends on the state that you live in. If you live in the
Mm-hmm.
United States, excuse me, and it depends on your insurance coverage, your insurance provider.
Mm-hmm.
Some people in states that are not mandated to have insurance coverage will still
Mm-hmm.
have fertility benefits through their employer.
Mm-hmm.
So, for instance, if your employer provides a type of insurance known as carrot fertility or progeny, and there's various different fertility providers where either it'll be a set number of cycles or it'll
Mm-hmm.
be a set budget. And so there's different ways that you'll have this coverage. The
Right.
large majority of people, unfortunately, do not have any insurance coverage unless they live in a particular state. And some states mandate some coverage, but not complete coverage. So it is extremely variable depending on where you
Mm-hmm.
live and depending on what your insurance provider is and depending on who your employer is.
Hmm. I see. Thank you. I'm not going to get into the specific costs of, surrogacy today because that is a huge topic. That is for another
Yes.
day to talk about.
Yes.
But I think it's good. I think that's such good advice for parents to, to really look into their insurance policy and find out what their coverage is for them to really have an idea if some of the services will be covered because, uh, again, like there's so much information on the internet. I have heard parents, tell me, I researched the cost of surrogacy. It's a super wide range. I have no idea what to expect. The truth is, it varies from case to case, and your
Yes.
insurance may have some sort of coverage, and depends on what state you live in, and also how many attempts
Yep.
you try to before achieving success. And there are so many factors, and unfortunately, that is really a huge topic that we can't uncover completely today. And what about communication? So, a lot of parents also ask about, oh, how often should I communicate with with my surrogate? Will I be, how do I know whether or not she's pregnant? How do I know if she's going to her appointments? And how do I know if she's taking care of herself during the pregnancy? So, from the clinic's perspective, how do clinics approach ongoing communication between intended parents and their surrogate, during this phase where the surrogate is under the fertility clinic's care?
So I think that this is a very important piece that needs to be established from day one. So once you sort of get paired with a surrogate, I think first to go over how you even get there, generally
Mm,
speaking, you want to have the right fit. So you want to get matched with someone that from the beginning you feel comfortable to carry your pregnancy. And also, the surrogate should also feel comfortable with the family that she's caring for. And so I think that having some sort of establishing what the communication will look like from the
mhm,
get-go can be helpful. I've seen some surrogates who want to be in constant contact with the parents and share everything because she wants to feel like they really get to be a part of this experience. And I've had
Mhm.
others who just don't really want to be, and the parents actually don't seem to care that much either. It's sort of a little bit more transactional. So I really think it depends on your personality, what you're hoping to get out of it, and if that's
Mhm.
well established from the beginning as well as documented from a clinic's perspective, there are legal implications to that and HIPAA violations, and you want to make sure that um, it's fairly well established what you can share and not share with the IPs in terms of her care and the bodily aspect of what she is going through.
Absolutely. Well, thank you so much for sharing all this today. And I think we covered a lot of important topics, actually. So just to recap, I think today we talked about, we talked about how to look for the right fertility clinic for intended parents, and we covered a few things. Number one, for parents to research a fertility clinic success rates and embryology lab, and there is a resource sart.org parents can utilize, especially looking at data that is within their age range so they can get the most helpful information. And if they do have questions about the success rates, they can always reach out to the clinic and ask specific questions. But also, the clinic's experience in surrogacy cases or international cases is also very important for parents to consider, especially if you are planning to go through surrogacy or if you're an international intended parent. And
Yep.
then the uh, medical screening process. We would encourage intended parents to talk to the clinic and figure out what is the medical screening process for the surrogate, and also for parents, what tests they undergo and when they're done, so parents have an idea what to expect generally. But also the genetic screening, I think that is
Yep.
also a good topic for parents to bring up to the clinic. Ask about the genetic screening options, and if parents are specifically interested in a genetic test, but the clinic does not offer that, that could potentially be a problem down the road. So it's always good to discuss that up front. And cost-wise, it's important for parents to, find out if a clinic they're interested in is in network or not, and what their insurance covers. And I think that is some homework parents can do on their own
Mhm.
before even starting this process or starting this journey. And last but not least, talk to the clinic about how they approach communication between intended parents and surrogates, because that is going to directly impact the parent's experience as well as the surrogate's experience. But then it also circles back to the point that we made earlier: a clinic that has a lot of experience in surrogacy cases generally know how to approach this type of communication.
Absolutely.
Right? Okay, so but last, before we go, do you have any advice for people out there who are considering becoming parents via surrogacy?
Yeah, I would say that after you have researched a clinic, and that you've researched data about the lab through SART, it's not a bad idea to really get a sense of the vibe of what you're getting into. So aside from, reading research from reliable sources or trying to get more information from reliable sources, and that can include the American Society of Reproductive Medicine, um, you know, SART, of course, has their own set of blog posts and information that you can get. Um, you want to really feel more at ease with the doctor that you're going to be working with. So, not
Mhm,
everything is only about data because there are so many amazing practices out there and so many amazing
yes.
labs. You want to feel like you got the right fit. So,
Mhm,
don't necessarily limit yourself to a single consultation and feel like you're
mhm,
stuck. You are allowed to
mhm,
get second opinions, you are allowed to get third opinions. Do research not just on the clinic, but on the doctor. If they have some form of a social media platform, you might feel like you're sort of getting to know them there. And it's just it's an important piece to feel like you have a team that's by your side because it's very overwhelming. So
Mhm.
you just want to feel like there's someone really in your corner who's going to help support you along the way, and you don't have to navigate this all by yourself as the IPs, as well as an incredible agency as well, because the agency is really half of the work who will really help you to get there.
Yeah, that is such great advice because I think in the end of the day, patients are or intended parents are going through this journey not just to work with robots, right? Like maybe some in certain areas, robots may do a better job than humans, but we, do not have that kind of connection with robots. So it is very, very important for parents to also, find the connection, find a clinic that they connect with,
Yeah,
and the team and the
absolutely.
doctors and the nurses that they connect with, because that is going to significantly elevate their experience while navigating through this difficult journey.
Absolutely.
All right. Thank you again, doctor. It's
Pleasure.
such a pleasure to have you here today. And everybody, here is Dr. Sasha Hakman from HRC Fertility. If you do have any additional questions you want to, you want us to talk about, please feel free to reach out to Family Source Consultants or to Dr. Hakman at HRC Fertility. We hope to see you next time. Thanks again, Dr. Hakman.
Thank you so much.
All right. Bye bye, everybody.